Welcome to the C-Suite at the Open. I'm Burke Suman, Head of Company Services based in Calgary. Joining us today from Montreal is Pascale Audette, President and CEO of Carebook Technologies, ticker CRBK on the TSX Venture Exchange. Pascale, welcome.
Thank you so much, Burke, for having me.
It's our pleasure. Can you start by telling our audience about what Carebook does?
Of course. Well, Carebook does nothing less than transform the healthcare industry today. And so we set ourselves up from the beginning to reinvent how the healthcare system and the industry should be working, and rebuilding it and offering solutions to rethink the system by putting the individual at the center. And so that's what we do in a nutshell. The timing is perfect because of the global health market is growing so fast and it's exploding right now. And so our model is really global. We're going after obviously the Canadian market, but also global. And so the timing right now is quite extraordinary for us. We're a B2B2C model, and so we see ourselves as an enabler in between the business, the different verticals, so the different health verticals and industries, and the individuals. And so we want to enable and provide that perfect bridge in between the different health providers and the individuals that sometimes are a bit confused. And so how do we offer a solution that helps the individuals better understand and be empowered to manage their health, but at the same time, the health providers themselves need better tools to automate certain services that they offer, to have a more personalized access to their patients and clients. And so we play that role in the middle. We're 100% tech. There's no doctors involved. We're not telemedicine. It's really a SaaS model, B2B2C.
You know, you said putting control, putting the patient in control, and I really love that idea of having control over your own digital health records and having that history at your fingertips, which is really interesting. You mentioned your three main verticals. Can you speak to this and also give us an idea of the growth strategy for each one?
Yeah, absolutely. So we have a core platform that's important to understand. So to start with, the foundational platform is filled with features that are really user-facing and really user-centric, and that's really one thing that differentiates us. And so those features would be health risk assessments, ability to connect to your health profiles, to keep track of all your medications. So all things like that. We have AI involved in this so that we can properly recommend. So a bunch of automated features, but then we offer those solutions to individuals attached to different industries, as I was saying. So the types of verticals would be pharmacy. That's our number one. So the focus or the client would be the pharmacy chains globally. And now we're going into the independent pharmacy also. And so we have successfully launched last May a Be Well app with Rexall in Canada, which is very successful. And now we're turning to global sales opportunities for our pharmacy platform. And so obviously international sales expansion is what we're looking at. So US, UK, Asia Pacific, Europe, amongst others. And we're scaling the integration process so that we can offer those solutions to less integrated to more integrated. So again, a pure SaaS model, online self-serve access. So that's going to be coming up in 2021. So that's our first vertical. The second one that actually was prompted by COVID-19, which we never thought we would end up being able to offer and contribute to what's happening to the population right now. So we quickly turned around our platform and reused a lot of the abilities we already had to scale, and really through a modular approach came up with two solutions. One that is a population app that is meant to help individuals in a set population. So take Canada, for example, it's an app that we provide to the population. And that app actually helps people self-manage their symptoms. So it's a symptom checker, but attached with AI that actually scans your vital signs through the camera of your phone. And in the back, we make recommendations through an algorithm, and it helps the individuals determine if it's time or not to seek medical care. We're not a diagnostic tool, but it really is meant to be a medical device that helps individuals manage their conditions. And then really easily after that, we came up with, okay, so people are sick, may not be sick, we're asked to be in quarantine, we're asked to stay home, but the economy needs to restart and the employers are struggling. And so we're going to use that same idea, but attach a dashboard for employers so that people that do their daily symptom checker and their scan, obviously we're protecting all the individual and personal information, but we're using that tool for it to be a go, no go, are you fit or not to go to work today? And so we're doing it in a very ethical manner, but built in a way to help the economy restart. And so that's the second vertical. And the third one is a mix. So we're actually exploring insurance right now because it's so relevant. Insurance is a very traditional industry that's struggling with a lot more digital types of competitors. Sorry, I came up with it. And so what our goal again is, not everybody has an IT team ready to go and able to build engaging solutions. We built on top of our platform the types of solutions like how do we rethink underwriting that's so long and so old in its approach? How do we help with chronic condition management at a distance for life insurance or for travel insurance, etc. So there's many industries right now that we're looking at, insurance being another. And so those are the three verticals we're looking at right now.
Right. And I mean, there seems like there's more pressure from consumers and governments to digitize health globally. So I think that's definitely helping out your business. You talked about the global digital health market in the first question. Yep. What's this valued at, and how will Carebook participate in it?
Well, it's estimated to reach $500 billion, US billion dollars by 2025. And so huge incremental growth we're seeing. And again, obviously brought on by COVID-19, it has accelerated even more. Why? Because the shift for both health providers and their need to actually be able to reach their clients and patients from a distance. And second, individuals themselves, they realize that they want to feel safer. And so the engagement part and the big walls that we were seeing, the big obstacles are all crumbling. Everybody wants digital health now. And so the growth is phenomenal. They're saying right now that 75% of all individuals expect to be able to use digital healthcare, which was nowhere near that a few years ago. And so we're really seeing the difference. On top of it, we're seeing governments actually changed their regulations and they expand their digital health reimbursement. And they speed up regulatory reviews. Like for our solutions, we do need to go through Health Canada through FDA, but they have fast tracks. And so we're seeing a change in mentality that's really expediting how quickly it's really obviously helping companies like ourselves.
Very relevant technology, specifically because more people are more conscious about their health. And like you said, this should continue to boost the digital health industry and its growth.
Absolutely.
You recently listed on the TSX Venture Exchange and completed financings of over 21 million, I think. What does a venture listing mean to Carebook?
A lot of work. I'm kidding. No, it definitely serves as a vehicle to raise our profile. So that I would say that's number one. It's unbelievable the opportunities that are coming already our way because of this access to, or because we are public, basically. Very generous pre-investments as signals the confidence from investors. And so again, new investors coming our way, which we're not prompting right now, and it's coming, which is absolutely exciting. We now have a very experienced board, as opposed to before we had a board, but now we actually have broadened our reach in terms of a board. And so more support, more empowerment, opening more doors for us. Incredible. And obviously with the increased funds, we're planning a few things. So fast track our global expansion to secure more customers, obviously. Expedite development of more features, and so grow in terms of our development capacities and the ability to create new verticals, and sometimes through M&A. So it will expedite how quickly we can enter some of those verticals with existing clients that we can beef up the offerings of those companies that we are actually starting to look at already. So that's about it. That's what it means for us.
Pascale, thank you so much for your time today, and I look forward to seeing your growth.
Oh, thank you so much.